Welcome colleagues to this part of our lecture series on venous thromboembolism, which is risk assessment and management. This section is a cornerstone of our efforts to combat VTE, emphasizing the critical importance of early identification and management of risk effect in our hospital for our patients. First step is the risk assessment. Risk assessment is our first line of defense. Upon admission, every adult patient must undergo a comprehensive VTE risk assessment conducted by the admitting physician. This process is not just a formality. It is a crucial evaluation that sets the stage for all subsequent preventive measures. This assessment includes evaluating patient history, current condition, and potential risk factors for both VTE and bleeding. It's a delicate balance as we aim to prevent VTE without increasing the risk of significant bleeding. And this point is very important. So you are not only assess the risk of VTE, you are assess the risk for VTE and the risk for bleeding. Then within 24 hours, this initial assessment must be reviewed by a senior clinician. This is a vital double check that ensures no risk is overlooked and that the most appropriate prophylaxis plan is put and in place. Third step is the continuous reassessment. Continuous reassessment is essential. Any change in the patient's clinical condition triggers a reassessment of their VTE and bleeding risk. It's a dynamic process reflecting the fluid nature of the patient's hospital stay. Documentation. Documentation is the backbone of effective risk management. Every assessment, decision, and change in patient status must be meticulously documented, whether in the patient's electronic medical record or in a hard copy of the risk assessment form. This ensures continuity of care and informed decision-making throughout the patient's hospital journey. The role of prophylaxis. Prophylaxis is prescribed based on the risk assessment, aligning with international guidelines. It's a tailored approach considering the unique aspects of each patient's situation to prevent VTE effectively. Finally, patient education plays a critical role. Patients and the family are informed about the risks of VTE, the reasons behind the prophylaxis plan, and signs to watch for. This empowerment is a crucial aspect of our comprehensive care model. In summary, effective VTE risk assessment and management is a comprehensive process. By adhering to these protocols, we not only adhere to best practice but also significantly enhance patient safety and outcomes.